In September 1972, we began as a small Migrant Health Services program connected to Merced General Hospital. Founding CEO Mike Sullivan led the way with a budget of less than $200,000, a small but mighty staff of 6, and a part-time MD. Services were provided at the hospital during evening hours. The following year, Merced Family Health Centers received its nonprofit corporation from the state of California and broke ground soon after on Childs Avenue in Merced, where our largest health center campus in the region remains today. Since that time, we've expanded greatly to meet community needs across Merced, Stanislaus, and San Joaquin counties, now serving nearly 150,000 patients each year through 45 clinical locations in the region. We have certainly grown, but we will never outgrow our mission: to improve the health of our patients by providing quality primary healthcare services to people in the communities we serve, regardless of language, financial, or cultural barriers. While 50 years sounds like a long time in a rapidly changing world, Golden Valley Health Center has not wavered from this mission. We were born out of a strong desire to increase access to healthcare in the lives of migrant workers and provide care for the Central Valley's critical farm worker population and the underserved. An organization that began as a small grassroots effort to care for the uninsured has defied expectations and become one of the 3 largest federally qualified health centers in California. Early on, it was clear that demand for primary care surpassed what the center could provide out of one small clinic in Merced, and rapid expansion began. By 1977, services were offered in Stanislaus County, with a clinic in Patterson, and we added medical clinics in Empire and West Modesto as well. The centers in our new service area were named Stanislaus Family Health Centers. In the years that followed, clinic proposals were approved throughout the Valley and Merced and Stanislaus counties. School-based health centers at Robertson Road and Hanshaw Middle School opened in 1993 and 1994, boosting student and community health in these underserved regions. It was in 1995 that we adopted a new name, Golden Valley Health Centers, which would provide a unified brand and a personal approach to healthcare as growth continued. At the time, we operated with a staff of 41, serving 42,000 individuals per year of all ages, treating medical and dental issues and urgent care needs across clinics in Merced, Modesto, Planada, La Grande, Los Banos, Dos Palos, Patterson, Newman, and Turlock. In 1998, we began a homeless healthcare program at the Modesto Inn to provide free medical services to Stanislaus County's homeless population. Over the years, we have prioritized pediatrics, women's health, and grown our offering of specialty services to include optometry, podiatry, nephrology, behavioral health, and more, to improve an array of health outcomes for residents. Technology use has improved too, ushering in an era of electronic medical record systems, text messaging, and social media outreach to keep our community connected to services. In 2012, CEO Mike Sullivan retired after 40 years of service. Following an extensive search, Tony Weber was named President and CEO of Golden Valley Health Centers. Since that time, GVHC has seen a logo revision, launched a foundation to support the work of the health center through philanthropy, and continued to grow, opening clinics in San Joaquin County and expanding the school-based health center program. In the midst of a pandemic, Golden Valley Health Centers has explored new frontiers to care for the changing needs of our community. We've introduced telehealth and remote health monitoring programs. We introduced an exciting new program as well called PACE, which allows qualifying older adults to live safely at home while receiving personalized medical care, meals, activities, and socialization. The ideology that everyone should have access to healthcare has been central to Golden Valley's work over the past 5 decades and remains our guiding principle today. At GVHC, we make quality healthcare accessible to all. From our humble beginnings in 1972, our mission has been to improve the health of our community. Through dedication, bold leadership, and a strong network of partners, 50 years later, we proudly continue this work and look forward to the future of healthcare through generations to come.